Blood flow restriction training involves applying specialized bands or cuffs to the upper limbs during resistance exercises. This technique partially restricts venous blood flow while maintaining arterial circulation, creating a hypoxic environment in the muscles. This condition triggers physiological responses similar to high-intensity training, enabling significant muscle growth with lighter weights and shorter workouts. Blood flow restriction training involves using specialized bands or cuffs on the upper limbs during resistance exercises. This technique partially restricts venous blood flow while maintaining arterial circulation, creating a hypoxic environment in the muscles. This condition triggers physiological responses akin to high-intensity training, promoting muscle growth with lighter weights. Blood flow restriction, BFR, training challenges traditional fitness norms by enabling muscle growth with just 20-30% of one repetition maximum compared to the usual 65% plus. This method offers significant gains in shorter sessions, revolutionizing training efficiency and reducing joint stress, making it a groundbreaking approach in fitness science. Numerous studies validate BFR's effectiveness through key physiological mechanisms. It accelerates type 2 fiber recruitment, increases metabolic stress with lactate accumulation, enhances cell swelling for better hydration, and boosts hormone release, elevating growth hormone and insulin-like growth factor 1 levels. These factors collectively optimize muscle adaptation without the joint stress of heavy resistance training. The effectiveness of blood flow restriction BFR training relies on precise pressure application. For upper limbs, aim for 40-80% of arterial occlusion pressure, and for lower limbs, 60-80%. This range ensures the necessary metabolic environment for muscle adaptation without risking adverse effects, balancing safety and efficacy in training. Professional KATSU equipment is the gold standard in blood flow restriction training, offering precise pressure control and monitoring, ideal for research and elite training, but costly at $1,000, $3,000. Affordable pneumatic bands, priced $50, $200, provide reliable pressure feedback, making blood flow restriction training accessible to more people while maintaining effectiveness. The BFR protocol involves using 20-30% of your 1 rep max, performing 15-30 reps per set, and completing 3-4 sets with 30 to 60 seconds rest. This approach maximizes metabolic stress, promoting muscle adaptation while reducing joint strain, offering an effective alternative to traditional heavy lifting. BFR bands are applied at the correct pressure to initiate restricted venous return, allowing blood to enter muscles but limiting outflow. This leads to rapid metabolite accumulation, such as lactate, which triggers cellular signaling for muscle adaptation. This metabolic stress pathway is crucial for hypertrophy, effectively targeting type 2 muscle fibers for size and strength gains. Ensure safety by avoiding excessive pressure, never fully occlude arterial flow, use appropriate pressure and cuff width for your limb size. Limit blood flow restriction application to under 20 minutes per session, removing bands between exercises. Be aware of contraindications like cardiovascular issues. Always seek guidance from a qualified professional when starting blood flow restriction techniques. Rehabilitation patients benefit from BFR by maintaining muscle without stressing healing tissues. Older adults can build strength with less joint stress, reducing fall risk. In-season athletes maintain strength with minimal recovery demands. Time-constrained individuals achieve efficient workouts with shorter sessions, maximizing effectiveness. Blood flow restriction training revolutionizes rehabilitation by enabling muscle growth with just 10-30% of normal load, crucial for post-surgery recovery. It counteracts immobilization effects, reducing muscle loss by up to 50%. Patients regain strength 25-40% faster, expediting their return to daily activities. This method preserves surgical repairs while preventing atrophy. Blood flow restriction training offers significant benefits for aging populations. Seniors experience a 76% improvement in functional strength with light weights, compared to 34% with traditional methods. Additionally, 68% report reduced joint discomfort, and adherence rates reach 83%. Blood flow restriction provides high-intensity stimulation without stressing aging joints, effectively combating muscle loss. Blood flow restriction training integrates seamlessly into athletic programs. Off-season, it intensifies training for lagging muscles without joint stress. In-season, it maintains muscle mass with minimal fatigue, crucial when recovery is limited. During rehabilitation, blood flow restriction bridges therapy and full training, preserving muscle while respecting healing tissues. BFR training excels with single joint isolation exercises, focusing on specific muscle groups. While compound movements are possible, they may be limited by the restricted limbs' endurance. These exercises ensure precise stress application to targeted muscles, maintaining control and safety. Traditional hypertrophy training uses 65 to 85% of one repetition maximum, causing moderate to high joint stress and requiring 48 to 72 hours for recovery. In contrast, blood flow restriction training uses only 20–30% of one repetition maximum, resulting in low joint stress and faster recovery of 24 to 48 hours. Blood flow restriction sessions are shorter, lasting 15 to 30 minutes, focusing on metabolic stress rather than mechanical tension. Blood flow restriction training offers unparalleled time efficiency. Research indicates that even ultra-short micro sessions of 6 minutes twice weekly can yield significant muscle growth over 8 weeks. While traditional methods may achieve slightly better absolute results, blood flow restriction's minimal time investment makes it a revolutionary approach for busy individuals seeking effective muscle development. Mark, an information technology professional, maintained 90% of his leg strength post-knee surgery with blood flow restriction, impressing his therapist. Sarah, a retired teacher, increased arm strength by 35% without pain, improving bone density. Jason, a competitive runner, preserved upper body strength with 10-minute blood flow restriction sessions, focusing energy on marathon training. Start with lighter restriction than you think necessary. Apply bands at 6 out of 10 tightness, feeling pressure but not pain. Choose 2 to 3 basic exercises. Perform 1 set of 30 repetitions, then 3 sets of 15 repetitions with 30-second rests. Aim for 7 to 8 out of 10 effort by the final set. Add repetitions before increasing weight for progressive overload. BFR training, when done correctly, is safe for circulation, posing no more risk than traditional exercise. Ensure bands are tight enough to restrict venous return but not arterial input. Your limb should feel full, not numb, with a slight color change. Aim for 5–7–10 tightness, allowing 1 to 2 fingers under the band. Blood flow restriction, BFR. Training offers significant benefits: an 84% reduction in joint stress, 65% time savings, and 3 times faster recovery. This method combines exercise efficiency with scientific innovation, making it ideal for both rehabilitation and elite athletes. Embrace blood flow restriction to enhance results while respecting your body's limits.